The COVID-19 pandemic has been a source of stress and anxiety for many, especially women working from home. Now studies are showing women were more likely than men to report stress-related increases in alcohol use during the pandemic. Dr. Mike with the Fox Medical team joins us live to talk a little bit more about this. Good morning, Dr. Mike. Thanks for joining us.
Always a pleasure, Leslie.
And likewise.
Always a pleasure.
So, Dr. Mike, when looking at these numbers, they seem a little alarming. What should people know in terms of what this really means and really self-assessing if they've crossed the line?
Well, I have to tell you, I've been personally affected by alcohol. My father was hit by a drunk driver. Now, alcohol is a way of coping. People, it's ubiquitous. It's everywhere. And during the pandemic, women in particular bore the brunt a lot of stress. They had to homeschool kids. They had to take care of their spouse. That's a nightmare in itself. And the fact is they had jobs and they had a lot of things going on. The studies show that they tended to drink more than they did before the pandemic. And this is very concerning for a couple reasons. Number one, Leslie, alcohol in women increases your risk of a number of cancers, including breast cancer. That's number one. Number two, it can ruin your life. It can really affect you. You get in a car, you took a risk, you drank, and then you injure someone. It's not good. In an instant, it can change your life. So what do you have to worry about? Number one, if you feel like people are saying, hey, I'm getting a little annoyed because you're drinking so much. If you are needing a drink in the morning, that means you may be hungover and you need an eye opener. Do you feel guilty? And basically, in your mind, you tend to feel like you need to cut down. These are the cage questions. And if you answer yes to any of them, you might have a problem. There's so many other ways to deal with stress other than alcohol, bottom line.
Right. Now, Dr. Mike, you did mention some of the risks related to health, and even just now you said that there are so many other ways. What are some other ways that women, really anybody, can really look at as forms of an alternative to alcohol? What are some things we can do?
Well, Leslie, I'll never forget, I had a patient who was an alcoholic, and I got him to stop drinking. And he said, you know, Dr. Mike, I never thought I could feel this good. I thought everybody felt miserable every day. And if you think of it in that way, and look, I don't want to be a teetotaler, someone that's not fun at parties. But the bottom line is you must do everything in moderation. What can you do if you're stressed? Mindful meditation, exercise. Find a hobby. I mean, there are times, Leslie, when I'm so stressed in my office, I go into the bathroom and lock the door. It's the one place where people can't get to me, and I do some mindful meditation. I just sit there and try to get myself composed. Now, if you have big time problems, then you need to see someone because there are certainly treatments available. And if it's long term, you might need psychotherapy. But the bottom line is, for most folks, limit the alcohol, start to have clarity in your mind, and start living your life. And you'll see, you feel so much better, so much better, Leslie.
Yeah, absolutely. Great advice there. Thank you, as always, Dr. Mike.